What are genetic trade-offs in multifactorial diseases? Imagine a tiny change in your genes could be both a gift and a challenge at the same time. That's what genetic trade-offs in multifactorial diseases are all about. These are situations where a genetic change might help in one way but cause problems in another. It's like a balancing act happening inside your body. In these diseases, many genes work together along with your environment to shape your health. Unlike single gene disorders, these conditions involve a mix of genetic and lifestyle factors. Examples include heart disease, diabetes, asthma, and even mental health issues like schizophrenia. Because so many genes are involved, a gene that raises your risk for one disease might lower your risk for another. For example, some genetic variants that boost immune responses might help fight infections better. But the same variants could also increase the chance of developing autoimmune diseases, where your immune system attacks your own body. It's a trade-off. What's good in one situation might be bad in another. From an evolutionary view, some gene variants that helped our ancestors survive harsh environments or fend off infections are still around today. But in modern settings, these same genes can make us more prone to chronic diseases. It's like a legacy from the past that influences our health now. There are also cases where genetic factors linked to one disorder seem to reduce the risk of a different disorder. For instance, some genes associated with autism spectrum disorder might be linked to a lower chance of developing certain psychotic illnesses. These opposing effects show how complex genetic trade-offs can be. Because many genes are involved, a person's overall risk for multifactorial diseases depends on a balance of these trade-offs. This can explain why some families have multiple health issues that don't follow a simple inheritance pattern. It's more like a tug-of-war between different genetic influences. Understanding these trade-offs helps doctors and genetic counselors interpret test results better. If a person has a gene that increases risk for one disease, they might also have a reduced risk for another. It's important to consider the whole picture, including lifestyle and environment, because these factors can tip the balance. For example, eating healthy, exercising, and avoiding smoking can influence how genetic risks play out. They can help tilt the scales toward better health, even if some genetic risks are present. In the end, genetic trade-offs in multifactorial diseases show us that our health isn't just about one gene or one disease. It's a complex dance between many genes, our environment, and lifestyle choices. Recognizing this helps us understand why health risks are often interconnected and why personalized approaches are so important.